Your body is screaming for help, but most men over 60 ignore the signs until it's too late. These habits protect your strength, stamina, and performance. Don't scroll. 99% never hear the last one, and that's the one doctors wish you knew first. Hormone myths. The very first place the fear takes root is testosterone. I hear it every week from men in my practice. They lean in, their voice drops, and they ask, "Doctor, am I draining my vitality every time I do this? Am I spending a resource I can't get back?" This worry is so common, so deeply ingrained that we have to unpack it with care. You're worried you're emptying a finite tank, that every act of release is one step closer to hormonal bankruptcy. That's the myth. It feels true, but it's a profound misunderstanding of how your body actually works. Here's what decades of research actually show. Your testosterone is not a fixed reservoir. It's a flowing river, constantly regulated by a sophisticated system in your brain and testes. Its levels naturally rise and fall throughout the day, peaking in the morning and dipping in the evening. After age 30, that river's average depth gradually lowers by about 1% a year. This is a normal process driven by the powerful forces of aging, genetics, your body composition, and your overall health, not by masturbation. Multiple controlled studies have looked at this directly. Does ejaculation cause a meaningful long-term drop in testosterone? The answer is an emphatic no. In the immediate aftermath of an orgasm, there are tiny temporary hormonal shifts. Some studies even show a slight increase in testosterone after a few days of abstinence. But these are minor ripples on the surface of that powerful river. They do not change its course. These fluctuations are so insignificant they don't even register in the grand scheme of your long-term hormonal health. Think of it like this. Your endocrine system is not a fragile glass that can be shattered by a single act. It's more like the thermostat in your home, constantly monitoring and adjusting to maintain equilibrium. It's resilient. It's designed to self-correct. Skipping a single workout at the gym might make you feel a little less powerful that day, but it doesn't erase the weeks and months of strength you've already built. In the same way, masturbation does not drain or delete your testosterone. Now, it's critical to distinguish between myths and real threats. Things like chronic obesity, severe stress, alcohol abuse, and, most significantly, poor sleep can absolutely crush your testosterone levels. Research has shown that just 1 week of sleeping less than 5 hours a night can slash a man's testosterone by up to 15%. That is a colossal drop. Compare that to the statistically irrelevant blip from masturbation, and you start to see where the real battle lies. The enemy of your vitality isn't your sexuality, it's a lifestyle that neglects the fundamental pillars of health. So for the man over 50, 60, or 70 who is feeling the fatigue, seeing the muscle loss, or struggling with motivation, the answer is not to retreat into a life of abstinence, shadowed by guilt. The answer is to get your levels checked by a physician who understands this. The solution will almost certainly involve improving your sleep, managing your stress, optimizing your nutrition, or perhaps medical therapy. It will not be a prescription to stop being a sexual being, so let the guilt go. Your body is not betraying you. It is not a leaky vessel. Masturbation is simply a neutral variable in a much larger, more complex, and more powerful hormonal equation. Prostate fears. As men age, there is a small walnut-sized gland that begins to occupy an enormous space in their minds, the prostate. It sits quietly at the center of your anatomy, right below the bladder, and its primary job is to produce the fluid that carries sperm. Because of its location, it is intimately involved in every single ejaculation, whether with a partner or alone. And it is here that a whole new set of fears begins to gather, whispered on forums and spread through half-truths. Is this wearing out my prostate? Is it making it grow? Is it, God forbid, causing cancer? On the other side, you hear the opposite. That frequent release is a kind of prostate cleansing, a miracle cure that will protect you from all harm. As with most things in health, the truth is not found in these extremes. It is found in the data. So let's look at what the science says. The most powerful piece of evidence we have comes from a landmark Harvard study that followed nearly 30,000 men for almost 2 decades. It was a massive undertaking, and its findings were stunning. The researchers discovered that men who ejaculated more frequently, defined as about 21 times per month, had a significantly lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. This was not a small effect. It was a clear, measurable, protective association. Now, the exact mechanism is still being debated by scientists. One leading theory is what you might call the stagnation hypothesis. Imagine your prostate's intricate network of ducts is like a river system. If the water flows freely and regularly, it stays clean. But if the river becomes stagnant, sediment and potentially harmful substances can settle and accumulate. Ejaculation is like a regular flushing current that may help clear out inflammatory agents or potential carcinogens before they have a chance to do damage. It's not a magic bullet, but a natural, functional part of the gland's maintenance. Of course, this does not mean that masturbation is a cure for prostate cancer or a replacement for medical vigilance. Far from it. Your risk is far more profoundly shaped by your age, your family history, your diet, and other genetic factors. But the evidence powerfully refutes the myth that masturbation is harmful. It suggests that moderate, regular sexual activity, solo or partnered, is either neutral or potentially beneficial for the prostate. It is certainly not the enemy. What about the other common prostate issue, benign prostatic hyperplasia, or BPH? This is the non-cancerous enlargement of the prostate that can cause frustrating urinary symptoms in so many men over 50. Here, the research is less clear-cut. Ejaculation does not seem to cause BPH, but it also doesn't appear to cure it. However, anecdotally, many men with BPH report a temporary relief of their symptoms after an orgasm. This might be because the muscular contractions of ejaculation help relax the gland and the surrounding pelvic floor muscles, easing pressure on the urethra for a short time. So what is the real takeaway here? It's that your focus should be on what truly matters. Instead of worrying about frequency, you should be vigilant. Know your family history. Talk to your doctor about PSA testing and digital rectal exams when you reach the appropriate age. Focus on maintaining a healthy weight, staying physically active, and eating a diet rich in vegetables and healthy fats. These are the pillars of prostate health. They have a far greater impact on your long-term outcomes than your masturbation habits ever will. Let go of the fear. Masturbation does not damage your prostate. View it as a natural function of your body, one that, within the context of a healthy lifestyle, may even play a small, supportive role in its long-term health. Erection worries. There is a fear that strikes at the very core of a man's sense of self, a quiet dread that can grow louder with each passing year. A patient of mine, a vibrant man in his late 60s, put it this way: "Doctor, it just doesn't feel the same. I think years of masturbation have finally worn me out. I'm weaker." This is perhaps the most persistent and emotionally charged myth of all, the belief that masturbation somehow depletes a man's erectile power, leaving him diminished. It's an understandable concern because erections do change with age. It's a physiological reality. Blood vessels lose some of their elasticity, nerve signals can slow down, and testosterone levels decline. When you mix these natural changes with the misinformation online, it's easy to connect the wrong dots and blame the wrong thing. But the science tells a very different story. An erection is not a simple on-off switch. It's a complex symphony of hydraulics and neurology. It requires healthy blood flow, clear nerve signals, and, this is the part almost everyone overlooks, strong, coordinated muscle support. Deep within your pelvis lies a hammock of muscles called the pelvic floor. They stretch from your pubic bone to your tailbone, and they are the unsung heroes of sexual function. They support your bladder and prostate, but crucially, they also control the flow of blood in and out of the penis. When these muscles are strong, they contract during an erection to help trap blood inside, creating firm, lasting rigidity. When they are weak, blood can leak out, leading to softer erections that fade too quickly. Here is the vital connection. Masturbation itself does not weaken this system. In fact, in many ways, it is a form of essential maintenance. It's the physiological principle of use it or lose it. Just as lifting weights tells your biceps to stay strong, regular erections and ejaculations, from any source, keep the delicate tissues of the penis oxygenated, flexible, and healthy. Research has consistently shown that men who maintain regular sexual activity, including masturbation, preserve better erectile function over the long term compared to men who become sexually inactive. You are not wearing the machine out, you are keeping the engine running. However, there is an important nuance here. The way you masturbate can matter. If a man develops a habit of using an extremely tight grip or requires overly aggressive, high-friction stimulation to reach orgasm, his brain and nervous system can become conditioned to that specific, intense signal. This is sometimes called death grip syndrome. It doesn't mean the penis is damaged, but it can make achieving orgasm with a partner more difficult simply because the stimulation feels different and less intense by comparison. The body has adapted to what you've taught it to expect. Think of it like developing a taste for extremely spicy food. After a while, a mildly seasoned dish can taste bland, not because there's anything wrong with the dish, but because your palate has been recalibrated. The wonderful news is that this is entirely reversible. It's not a hardware problem, it's a software issue. By consciously practicing with a lighter touch, focusing on sensation rather than just the goal of orgasm, and varying your technique, you can retrain your nervous system and restore its sensitivity. And this brings us back to the pelvic floor. Kegel exercises are not just for women. Decades of research have confirmed that for men, strengthening the pelvic floor can dramatically improve erection quality and even help with premature ejaculation. It's one of the most powerful evidence-based tools at your disposal. You can do them right now. As you read this, contract the same muscles you would use to stop the flow of urine midstream. Hold for a count of 3, then relax completely. That simple contraction, repeated 10 to 15 times 3 times a day, can, over time, rebuild the very foundation of your erectile strength. It costs nothing. No one knows you're doing it. And it works. So let's reframe this. If your erections are changing, it is not a sign that you've used them up. It is a signal from your body to check on your cardiovascular health, to get more active, and to start training those essential hidden muscles. Brain chemistry. For most men, the conversation about masturbation begins and ends below the waist. We focus on the plumbing, the prostate, the penis, the hormones. But the most profound effects of this act may not be in your body, but in your brain. This is not just a physical release. It is a powerful neurological and psychological event, tapping into the most ancient reward and relaxation pathways wired into your very being. Understanding this chemistry is the key to understanding its true role in your life. When you become aroused and reach orgasm, your brain is flooded with a complex cocktail of neurochemicals. The first is dopamine, the molecule of motivation and reward. It surges, creating that intense feeling of pleasure and accomplishment. It is the brain's way of saying, yes, that was good, do it again. But it doesn't stop there. Immediately following orgasm, the brain releases 2 other powerful hormones, oxytocin and prolactin. Oxytocin is often called the bonding hormone, and it creates feelings of trust, relaxation, and emotional connection, even when you are alone. Prolactin has a deeply calming, almost sedative effect. It's the primary reason many men feel sleepy after climax. Finally, your brain releases endorphins, your body's natural painkillers, which can explain why orgasm sometimes provides relief from headaches or other chronic pains. This neurochemical cascade has real, measurable effects on your well-being. The release of oxytocin and prolactin, combined with the reduction in stress hormones like cortisol, creates a state of deep nervous system relaxation. It can lower your blood pressure, reduce inflammation, and shift you out of that fight or flight mode that so many of us live in. For many men over 50, this is the primary reason they find that masturbating before bed is a remarkably effective sleep aid. It's not just a distraction, it is a biological reset button for a stressed out mind. But here is where the nuance is absolutely critical. Any activity that provides such a potent dopamine rush can become a crutch. The brain is an adaptation machine. If it learns that masturbation is the quickest, easiest way to get relief from stress, anxiety, loneliness, or boredom, it will start to crave that solution above all others. Using it occasionally to unwind is perfectly normal and healthy, but relying on it as your primary coping mechanism can, over time, blunt your motivation for other things. Think of your brain's dopamine system like the soil in a garden. A healthy amount of fertilizer helps things grow. But if you douse the soil with too much, too often, the soil becomes depleted and less responsive. You need more and more fertilizer just to get the same small result. This is what can happen with excessive stimulation. The brain's dopamine receptors can downregulate, meaning you need more stimulation to feel the same level of pleasure, and the baseline level of motivation and joy in everyday life can diminish. It can become a cycle of chasing a feeling rather than building a life. Here's a different way to look at it. Imagine that release is like a warm, comforting blanket on a cold night. It's a wonderful tool to have. But if it's the only tool you use, you might never learn how to build a fire, put on a sweater, or connect with another person for warmth. The goal is to have a full toolkit for managing your emotional life. So the practical takeaway is this: observe the effect it has on you. If it leaves you feeling relaxed, refreshed, and more present, then it is serving a healthy function. If it consistently leaves you feeling drained, disconnected, or more isolated, it may be a sign that the behavior has become unbalanced. It might be time to add other tools to your toolkit: meditation, exercise, deep conversation, creative hobbies, to ensure your brain's chemistry stays rich, responsive, and balanced for the long haul. Unbalanced habits. Up to this point, we have systematically dismantled the myths and focused on the neutral or even beneficial aspects of masturbation, but an honest conversation requires us to look at the whole picture. For a small but significant percentage of men, this behavior can become unbalanced. It is not the act itself that is inherently harmful, but the role it begins to play in a man's life. When it stops being a choice and starts feeling like a compulsion, when it replaces connection instead of complementing it, that is when we need to pay attention. The line between a healthy habit and a harmful one is not defined by a number. There is no magic frequency. 3 times a week is fine, 8 times is a problem. That's not how it works. The real measure is its impact on your life. Does it interfere with your work, your relationships, your energy, or your ability to feel genuine joy? Does it feel like something you are in control of, or something that is in control of you? That is the defining question. Think of it this way: food is necessary and one of life's great pleasures. But if you find yourself compulsively eating late at night to soothe an anxiety you cannot name, you understand that the problem is not the food. The problem is the pattern. The food has become a tool for avoidance, a way to numb a deeper discomfort. Masturbation can function in exactly the same way. When a man relies on it as his sole strategy for dealing with stress, loneliness, anger, or disappointment, he creates a powerful neurological loop. The brain learns, discomfort arises, seek, release, feel temporary relief. Repeat. Over time, other, more adaptive strategies like talking to a friend, going for a run, solving the underlying problem can atrophy. Another area where imbalance can appear is in the context of a relationship. If a man consistently chooses solo activity over intimacy with his partner because it feels easier, faster, or less emotionally demanding, it can become a form of avoidance. It's a retreat from the vulnerability and complexity of real connection. Over time, this can create a chasm in the relationship, leaving both partners feeling isolated. Again, the issue isn't the masturbation itself. It's the fact that it's being used to sidestep the challenges and rewards of shared intimacy. True addiction is rare, but it is real. The World Health Organization now recognizes compulsive sexual behavior disorder as a legitimate mental health condition. This is diagnosed when the behavior becomes a central focus of a person's life, is pursued despite negative consequences, and feels impossible to stop. This affects an estimated 3 to 6% of the population. If you feel you fall into this category, it is not a moral failing. It is a recognized condition for which effective treatments exist, including therapy and behavioral strategies. For most men, especially as they get older, the risk is less about full-blown addiction and more about these subtler patterns of avoidance. Avoiding difficult emotions, avoiding a difficult conversation with a partner, avoiding the deeper health or life issues that are causing the stress in the first place. So here is a simple, practical way to check in with yourself. After the act, ask yourself honestly, am I choosing this or am I escaping into it? There is no judgment in that question. It is simply a tool for self-awareness. If the answer is consistently escape, it may be a sign that it's time to find new tools, re-engage with the world, or perhaps speak with a professional. Balance, not shame-fueled abstinence, is always the goal, and support is always available. You do not have to carry that weight by yourself. Finding balance. After we have walked through the science on hormones, the prostate, erections, and the brain, the conversation in my office always arrives at one final, intensely practical question. Okay, doctor, I get it, but just tell me, how often is too often? Every man wants a number, a clear rule that tells him he is on the right side of the line. He is looking for a prescription, a simple guideline that will finally put his anxiety to rest. And the most truthful and helpful answer I can give is this: there is no universal number. Science and medicine cannot give you a magic frequency that defines health for every man on earth. It is a deeply individual equation. I know healthy, vibrant men in their 70s who masturbate several times a week, and I know equally healthy men who do so once a month. The key is not the number on the calendar, it is the impact on your life. If your current frequency leaves you feeling energized, sleeping well, and feeling connected to the people you love, then your frequency is right for you. If it leaves you feeling fatigued, irritable, disconnected, or compulsive, then it is time to adjust, regardless of the number. Your own body and your own life are the ultimate arbiters of what is healthy. That said, population studies can give us a sense of what is common. Large-scale surveys suggest that for men in middle age and beyond, ejaculating anywhere from 4 to 7 times per month is a very typical range. But please, hear me clearly. This is an observation, not a recommendation. It is an average, and you are not an average. You are an individual. Do not measure yourself against a statistic. Measure yourself against your own well-being. Think of it like your diet. There is no single diet that is perfect for everyone. One person thrives on a high-protein diet, while another feels best with more plant-based foods. You learn what works by paying attention to how you feel, your energy, your digestion, your mood. The same principle of mindful self-assessment applies here. The goal is to find your own personal equilibrium, the balance point where this activity adds to your life rather than taking away from it. So how do you cultivate that balance? First, be intentional. Avoid using it as a mindless habit to kill time. If you choose to do it, be present for the experience. Allow your body and mind to connect. Second, if you are in a relationship, ensure that solo activity is a supplement to, not a substitute for, partnered intimacy. It should be an and, not an or. If you find yourself consistently avoiding your partner, that is a signal to look deeper at the relationship dynamics or your own anxieties, not to blame masturbation. Third, diversify your stress management toolkit. Do not let this become your only outlet. Make sure you are also using exercise, mindfulness, time in nature, and meaningful social connections to regulate your nervous system. This prevents over-reliance and keeps your brain's reward circuitry healthy and balanced. And finally, here's a simple diagnostic tool you can use. The next time you masturbate, ask yourself these 3 questions afterward. 1. Do I feel physically better, more relaxed, less tension? 2. Do I feel emotionally better, calmer, more at peace? And 3. Did this activity interfere with an important responsibility or relationship in my life? If your answers are consistently yes, yes, and no, you are almost certainly in a healthy, balanced place. If the answers start to shift, you have your signal that it's time to make a small adjustment. This isn't about morality. This is about managing your own energy, your own health, and your own life with wisdom and self-awareness. We started this journey together with a quiet question, the kind of question men have carried in silence for generations. Is this natural part of me somehow harming me as I get older? We have now walked through the medical research, dismantled the long-standing myths, and confronted the fears head-on. The conclusion, grounded in science and clinical experience, is refreshingly simple. Masturbation is not the enemy of men's health. It does not drain your testosterone. Your lifestyle choices have 1,000 times more impact. It does not damage your prostate. In fact, the best evidence we have suggests regular ejaculation may even be protective. It does not inherently weaken your erections. Vascular health and pelvic floor strength are the true keys to potency. And in your brain, it can act as a natural tool to release stress, calm your nervous system, and even invite deeper sleep. Shame has done more damage to men's health than this act ever could. So if you take one thing away from our consultation today, let it be this. Start treating your sexual health with the same respect, curiosity, and intelligence you apply to your diet or your fitness routine. Ask yourself, honestly and without judgment, how this part of your life is serving you. Is it contributing to your vitality? Is it supporting the man you want to be? If it is,